Hello everyone, thanks for coming back to see another Upgrade Your OET vocabulary quiz. My name is Sona and I'm going to be your OET teacher. In today's quiz, we're looking at what is a tick? Well, a tick is actually one of these creatures here that you can see. They are tiny spider-like creatures that live in woods and areas with long grass. They're found all over the UK, in many different European countries as well. I'm not sure about the other parts of the world, but I'm sure in coldish climates they can be found, but just check your local website. Now, ticks don't jump or fly, but what they do is attach to the skin of animals or humans as they brush past them. Once a tick bites into the skin, it feeds on blood for a few days before dropping off. Now, that in itself doesn't sound so sinister, but what would you say, or how would you react if a patient comes into you and says, I think I've been bitten by a tick, or I think I've got a tick bite? Now, the problem here is that tick bites are associated with Lyme disease. Okay, this is what the NHS UK website tells us about Lyme disease. So the first thing to know is how to spot and remove ticks. And this is something you may need to advise your patients on if you know that they're going on holiday to a tick-prone area. So tick bites are not always painful. Your patient may not even notice that they have a bite or they have a tick unless they see the tick itself on the skin. Therefore, everyone who's walking in these areas or being outdoors should regularly check their skin, their children's skin and their pet's skin as well. If a tick is attached, then you'll need to remove it. The patient will need to remove it. And they do that by using a fine-tipped tweezer. So fine-tipped is very delicate, it's very precise. So fine-tipped tweezers or a tick removal tool, which can be bought from pharmacies and vets, etc. Grasp the tick as close to the skin as possible. So this word here, grasp, means hold tightly. Grasp the tick as close to the skin as possible. Slowly pull upwards, taking care not to squeeze or crush the tick, and dispose of it when you've removed it. Clean the bite with antiseptic or soap and water. The good news is that the risk of getting ill is low because only an infected tick can spread the disease. So your patient won't need to do anything unless they begin to feel unwell. And this is when they might come to you. They might be worried about having Lyme disease, which is a bacterial infection that can be spread to humans by infected ticks. It's easier to treat if it's diagnosed early. And here are the symptoms. So many people with early symptoms develop a circular red rash around the tick bite. The rash can appear up to 3 months after being bitten by a tick and usually lasts for several weeks. And most rashes appear within the first 4 weeks, so within a month of being infected. Your patient may come and see you if they're worried. So if your patient's been bitten by a tick or visited an area in the past month where infected ticks are found, this is normally signposted in the UK. They may have flu-like symptoms such as feeling hot and shivery. Shivery is when you can't stop shaking and you're feeling hot and cold at the same time. They may have headaches or aching muscles. Listen to the pronunciation of this, aching muscles, or they are feeling sick, or they have this red rash we were looking at. And what will happen at the appointment is you, as the GP, will ask them about their symptoms, consider any other bites that you've heard about or they've heard about. Problem is that it's a little bit difficult to diagnose because Lyme disease has symptoms associated with other problems too, but there are 2 types of blood tests, etc., that you can use. If your patient has Lyme disease, you'll prescribe them with a 3-week course of antibiotics. Always remind your patient to finish their course, even if they start to feel better, of course. And sometimes people will need to be referred to a specialist in hospital for injections of antibiotics. Of course, prevention is better than cure, so if your patient is worried and wants to know more about how to avoid tick bites, well, this is what they should be doing. Basically, reducing the risk of being bitten. So cover your skin while walking outdoors and tuck your trousers into your socks. Tuck means keep it under your socks, so push it into your socks. Use insect repellent on your clothes and skin, and products containing DEET are best. Stick to paths wherever possible. Paths are where you walk, they are the designated area where you walk. Stick to means keep, don't wander off, don't go away from the designated areas. So stick to paths wherever possible, and wear light coloured clothing so ticks are easier to spot and you can brush them off if you see them. So just push them off. If you're interested in finding out more about our courses, check out the link below, which will take you to our Udemy on-demand medicine speaking course. It's called OET Insights, and it's full of vocabulary, pronunciation, tips, tricks, and model answers that will help you upgrade your OET score. Thanks very much for listening, and see you again next time. Bye-bye.